So today we shall learn about ventilator graphics part 2 loops. So loops in loops we have got pressure volume loop and flow volume loop. So what is a loop? Loop, it is a graphical representation of dynamic relationship between two variables. That is, in case of pressure volume loop we have got pressure and volume. In case of flow volume loop, flow and volume. So both during inspiration and expiration. So this is the pressure volume loop in a patient with volume control ventilation. So we should not confuse with the pressure volume loop which is seen in the cardiac cycle. So there the pressure is along the y-axis and volume is along the x-axis. In case of respiratory system, it is plotted opposite way, that is pressure along the x-axis and volume along the y-axis. So here, so this is the volume control ventilation. So with no inspiratory pause. See here, this is the inspiratory part of the loop followed by expiration. So followed by expiration. See this part of the loop, there is, because of the presence of the endotracheal tube, here there is some amount of resistance in the beginning of the expiration. Followed by this, there is a decrease in volume with decrease in pressure. So this initial amount of resistance is because of the presence of the endotracheal tube. So whenever this loop it shifts towards the right side, then you tell the compliance of the lungs is decreased. So that means when for a given increase in pressure, the tidal volume achieved is less. So in case of high compliance, the loop is shifted towards left side. This means the pressure is decreased but the volume is increased or volume remains constant. So that means it indicates high compliance of the lungs. So here in this we can see this is the pressure volume loop in case of face mask positive pressure ventilation. So here this is the inspiration followed by this is the expiration. Because there is no endotracheal tube, the resistance to expiration is very minimal when compared to the ET tube as shown in the previous slide. So here the expiration is, so the resistance to expiration is less. So there is a, with the sharp decrease in pressure, there is a decrease in volume also. This is a biconvex loop which is seen during face mask positive pressure ventilation. So as I told, the absence of the endotracheal tube, so the less resistance, so pressure drops rapidly, and this is the double convex loop. So here this loop we shall see. So here what is happening here is the loop is starting at around 5 centimeters of water. This is the inspiration and the expiration. So that means here some amount of even end expiratory pressure is also there. That is a positive end expiratory pressure is applied to this patient. In this loop is not starting from zero. Here also a peep of around some 1 or 2 centimeters of water may be there. So this part is the inspiration followed by this is the followed by there is a drop in pressure. This drop in pressure is occurring because of the inspiratory pause. So whenever the inspiratory pause is applied, there is a drop in pressure and the volume which is present in the lungs is redistributed. So there is a drop in pressure and again there is expiration. So this peak, the highest pressure which is recorded during this respiratory cycle is called as peak inspiratory pressure, and the pressure which is recorded during the inspiratory pause is called as a positive pressure, the plateau pressure. So in this we can see here what is happening here is this is the pressure volume loop. So with a rapid increase in pressure, the amount of increase in volume is very less. Okay, so the pressure is rising from around 1 or 2 centimeters to 25 centimeters of water. So but the volume change is only minimal. Then with the same constant pressure, the change in volume is more. Okay, with the same constant pressure, the change in volume is more. So this indicates this is the pressure control ventilation. So at this point of pressure, so the pressure is kept constant and the flow rate is decreased. So decelerating flow, and hence there is this tidal volume is reached, followed by exhalation. So here you can see this pressure volume loop. This loop, it has gone towards the negative side also. This is the positive pressure and this is the negative pressure. So here this is the inspiratory part of the loop and this is the expiration. So here inspiration is negative, means this is a spontaneous breathing patient. So here you can see again this is also pressure is going on towards the negative side, means this is a spontaneous breathing patient, but the loop is starting at around 10 centimeters of water. So this means this is spontaneous breathing patient with positive and expiratory pressure. So here the loop becomes rectangular. Here you can see this is intermittent mandatory ventilation. So sometimes patient is having a spontaneous breath and sometimes patient is having a mandatory breath. So this is called as, here we have got the initial part of the loop is going, it is going towards the negative, followed by there is a positive pressure. So this means here the initial negative, it is because of the patient triggered ventilation followed by the mandatory breath. So this is assist control mandatory ventilation. So here you can see this dotted line, it is the normal loop. This indicates the normal compliance. So here this loop, it is shifted towards the right. This indicates there is decreased compliance of the lungs. So in this slide we can see these are the lung compliance changes and pressure volume loops. This green color, it indicates the normal pressure volume loop. So in case of this is volume control ventilation. So here in case of volume control ventilation, the volume will be constant. So whenever there is a decrease in the compliance of the lungs, so then the peak airway pressure, it goes on increases. So here this is the peak airway pressure, it is increasing. So for the same volume, the peak airway pressure is higher. Say at this green point, it may be around 20 centimeters of water, but here it has become to 25 or 30 centimeters of water for the same tidal volume achieved. So whenever the compliance of the lungs, it improves. So what happens? This loop is shifted towards the left side. You can see this is the yellow loop. So here what is happening, for the same given preset tidal volume, the peak airway pressure achieved is less. So around 15 centimeters of water. This indicates compliance of the lungs is improved. So this is about the, see in this loop what we can see is this is the pressure volume loop, pressure along the x-axis, volume along the y-axis. So here the pressure is constant. You can see here the pressure is constant, but the tidal volume achieved is different. So this is pressure control ventilation. In pressure control ventilation, this green represents, this is the normal loop. So here whenever there is a decrease in the compliance, so what happens, for the given pressure, the tidal volume achieved will be less. So this is in case of decreased compliance. Whenever the compliance increases, what happens is, for the same given this pressure control, say around 20 centimeters of water, your tidal volume achieved will be more when the compliance increases. So here we can see this is dotted line, it is the normal pressure volume loop. Here in this one, what we are able to see here is, so for the airway pressure, it is increasing from 0 to 40 centimeters of water. So 40 centimeters of water, but the tidal volume increase is very less. And again, after this point also, there is an increase in pressure from around 40 centimeters to say 43 centimeters of water with increase in the tidal volume. So here what is happening here? This is an this is increased airway resistance. Maybe patient may be in a pressure control ventilation. Okay, but usually this will not be a pressure control ventilation, because in case of pressure control ventilation, pressure will be kept constant, and what happens here is you will not set a pressure of 40 centimeters of water in case of pressure control ventilation. We will keep a pressure control of around 25 or 28 centimeters or less than 30 centimeters of water only. So this is not a pressure control ventilation. This is a volume control ventilation with increased airway resistance. Okay. So with increased airway resistance, so the same, the tidal volume is reached, and followed by what is happening here is we can see with so much of decrease in the pressure from 42 centimeters of water to 10 centimeters, the tidal volume is decreasing by only 100 ml. So this increase, there is lot of expiratory airway resistance is there. So here what we can see here, this is a dotted line, it indicates the normal. This is the spontaneous breathing, So whenever there is an increased airway resistance is there, so then we can see here there is an increase in airway pressure, and also the expiratory resistance is also increased. So there is more amount of pressure is generated by the patient to exhale the air. So this is increased resistance in a patient who is breathing spontaneously. So here in this loop, what we are seeing is, so this is the starting point of the loop, followed by this is there is an increase in the pressure, but there is very minimal increase in the tidal volume, followed by this is the inspiration, then this is the expiratory part of the loop. So here what is happening with when the airway pressure is decreasing from 30 centimeters of water to around 5 centimeters of water, the amount of tidal volume or the it is very less. So that means there is a lot of resistance for exhalation, and followed by this loop there are some serrations in the loop, and followed this loop it is not touching the starting point, so it is touching somewhere around 100 ml or 200 ml. So this indicates, that means this is a open loop. So this patient is having severe COPD with so much patient is struggling to exhale the air, but here what is happening, only minimal amount of air he is able to exhale because of the increased airway resistance. And also before the exhalation is complete, that is before this exhalation it touches the zero, that is the next inspiration starts in this patient. So this is a open loop. So what is this open loop? Normally what happens, the beginning, wherever the point it starts and it has to end at that point. The inspiration will start at a point and it goes up, and then the expiration it comes and joins at the same point. So this is the normal pressure volume loop. Whenever there is a gap between the starting and the ending point, then it is called as open loop. So here, what are the causes for open loop? As I've shown in the previous slide, causes for open loop are whenever there is a leak in the circuit. Okay, that means there is some amount of volume loss. It indicates nothing but at the beginning point it is not coming, at the beginning point it is starting, the inspiration is starting, but the ending point is something else. The exhalation is coming and stopping at some other point. So this indicates there is some amount of volume is lost. So this volume is lost. It occurs because of the any leak which is present, or it may be because of mask anesthesia or a damaged endotracheal tube cuff, or in case of supraglottic airway device in patients with COPD, and also is tension pneumothorax and lung resections. Patient will be having leaks. So here we can see this is the open loop. So the inspiration is starting at this point, it is going like this, and the expiration is coming and it is stopping here. That means the beginning point is different, and this is the starting point, and this is the ending point. So there is a gap. So by seeing this loop, we can say the amount of volume lost is around 150 to 200 ml. So here in case of same again in case of flow volume loop, that is flow along the y-axis and volume along the x-axis. So this is the inspiration. So here this is from inspiration it is going like this, and expiration it is coming and joining here. So here the beginning point is different and the ending point is different. So this indicates the volume loss. So now we have got to know about what is this open loop. Now we shall know what is this overshoot loop. Overshoot loop means the beginning point and also the ending point are different, but the ending point it overshoots the beginning point. So overshoot loop indicates that the exhaled volume is greater than the inspired volume. So it indicates that whenever there is a surgeon is doing surgery and there is a pressure on the thorax, then the amount of air which is present in the lungs, that is also other than the exhaled tidal volume. Even in addition to the exhaled tidal volume, because of the pressure, the volume of air which is present in the lungs, that is also exhaled. So this is because of that, and also because of monitor needs to be recalibrated. So here we can see this is the beginning point of the loop, and this is the beginning point, and this is the ending point. So here it has started inspiration and then it goes like this expiration. So it has come to, so this the difference between these two, this volume is called as the this overshoot loop. It may be around some 50 or 100 ml. So that much extra amount of air is expelled. Okay. So now we can see this loop where this is a pressure volume loop. There are a lot of serrations and disturbance in this loop. So this indicates a lot of secretions are present in the endotracheal tube. Same in, you can see in the case of flow volume loop. Here also during the inspiration and also during the expiration there are a lot of irregularities and serrations in the loop. This indicates secretions are present in the endotracheal tube. So now how to diagnose whether auto peep is present or not. So auto peep, it occurs, that is auto peep or intrinsic peep, occult peep, okay, whenever the actual expiratory time, okay, whenever the expiratory time it is less than the required respiratory time, okay. So expiratory time required for the complete exhalation of the tidal volume, whenever that it is less, so then this air will be trapped in the lungs, and that this results in intrinsic peep or auto peep. So here we can see this is the flow volume loop. So at the beginning of this is the beginning point, inspiration, and followed by here this is the expiration. So here it is not touching the baseline. So it is not touching the baseline is before the expiratory flow is complete. So the next inspiration starts. That means before the expiration touches the baseline, before complete exhalation, next inspiration starts. This is called as air trapping, which is seen in patients having bronchial asthma or COPD. So here in this graph we can see that there are no any recordings in case of pressure volume loop and also flow volume loop. This indicates any disconnection between the sensor and the breathing system. So now in case of ARDS we should know how the pressure volume loop it helps us in adjusting the settings in a patient with ARDS. So in ARDS what happens here, patient will be having very stiff lungs. So, and there is also repeated opening and closing of the alveoli with each respiration. So in order to prevent this repeated opening and closing of the alveoli, so that will also result in what is atelectrauma. So in order to prevent this one, this pressure volume loop will be very helpful to us. So if we initially see the pressure volume loop in a patient with ARDS, it will be something like this. Okay, the beginning curve will be something like this. Okay, this is the inspiratory part of the curve. So here for this is the volume control ventilation which was kept in that patient. So here what is happening here is for a given rise in pressure, pressure is rising from this point to this point. So, but the change of volume is very minimal. After this point, the change in volume is, there is a sudden change in the slope of the curve, and the change in volume is more. And again, after this point, with the much more increase in pressure, the change in tidal volume is less. So, wherever this slope of the curve changes, this is taken as the lower inflection point, and this is taken as the higher inflection point. So this lower inflection point indicates that after this point there is an increase in compliance of the lungs, or there is an increase in change in the volume. It is more for a given change in pressure, that is nothing but compliance. So below this point there is collapsing of the alveoli. So that means you have to keep your positive and expirator pressure above this lower inflection point. And what about this higher inflection point? Above this higher inflection point, there is very minimal change in the tidal volume, but the pressure rises very high. So this indicates that above this above this pressure, so above this pressure, what is happening? The barotrauma occurs, or more barotrauma occurs to the patient. So we have to keep your positive and expiratory such that it is near the or just above the lower inflection point, and your pressure control, it is at this point, so that is just below the upper inflection point. So this helps in achieving normal oxygenation of the lungs, and also preventing this atelectrauma. So this one we can see here. This is whatever, this is the PEEP is applied. This is the inspiration, the expiration. This is the normal pressure volume loop. So here we can see this is the inspiration. So here what is happening here is a terminal beaking is occurring here. So for a given rise in pressure, the tidal volume change is very less. So this is called as terminal beaking. This is followed by an expiration. So this indicates above this pressure, it is of no use to the patient, and it is more harmful to the patient. So we have to keep this pressure control below this point. So now coming to this flow volume loops. In flow volume loops, we have got flow along the y-axis and volume along the x-axis. So this is the flow volume loop in case of volume control ventilation. As I have told previously, in case of volume control ventilation, your flow will be a constant. So here you can see this is the constant flow. So followed by, this is the expiration. So during inspiration it will be a constant flow only. In expiration, in almost all the modes, it will be a decelerating flow only, because it is a passive process. And always remember that at the beginning of expiration the flow of rate will be very high, followed by there will be decreased. So here this is in case of volume control ventilation. And here in this flow volume loop, you can see this is the inspiration, and followed by this is the expiration. So the inspiratory flow, it is sinusoidal type of waveform. This indicates this is spontaneous ventilation, and followed by exhalation. So here this is the inspiration. Okay, this is sinusoidal type of waveform. This indicates this spontaneous breathing, and followed by this is the exhalation. So here, because there is a decreased, actually it is given as a controlled ventilation. Maybe controlled ventilation, usually it will not, controlled ventilation, the flow of gas will not be like this. The flow of the gas usually it will not be like the sinusoidal, but it will be usually either a decelerating flow, or it will be a constant flow. So this is there is somewhat error in this slide. Okay, so followed by this is the exhalation. So because there is no this endotracheal tube, there is decreased resistance to exhalation. So there is exhalation is higher flows are seen during exhalation. So what is the main use of this flow volume loops? Flow volume loops main use it is we know what is the level of the airway obstruction. So main it is in case of airway obstruction, whether it is an extrathoracic airway obstruction is there, or there is an intrathoracic airway obstruction, whether it is a variable extrathoracic, variable intrathoracic, or it is a fixed airway obstruction, and also in case of restrictive lung disease. All this will be very helpful. So one more thing, always you remember that the inspiratory limb of the loop, okay, is the one which is affected during extrathoracic obstruction, because you just remember a case of thyroid, very huge thyroid gland. So very huge thyroid gland, that is an extrathoracic obstruction. In case of this extrathoracic, it is compressing upon the trachea. What will happen here is during spontaneous breathing, what happens? There is a negative pressure in the airway. So there is negative pressure in the airway. Because of this negative pressure, and above that there is a positive pressure from the thyroid gland. So that causes compression of the trachea. So this leads to only the inspiratory part of the loop will be affected. Now what happens during expiration? During expiration, the airway pressure, it becomes positive. So this positive airway pressure, it maintains the patency of the trachea. The opposite occurs in case of intrathoracic obstruction. So I will show in the next slide how it will be. So this is the flow volume loop. So here we can see there is a decrease in both inspiratory flow and also expiratory flow. This indicates fixed intra or extrathoracic obstruction. So the flow of gas, it is limited both during inspiration and expiration. So this is either fixed intra or extrathoracic obstruction. So here this dotted line is the normal loop. So here what is happening? There is a decrease in the inspiratory flow, followed by there is a normal exhalation. That means this is a variable obstruction. Which type of variable obstruction is this one? Because the inspiratory part of the, when does the inspiratory part of the limb is affected? Whenever the obstruction is caused by an extrathoracic mass, that is in case of thyroid mass, that is because the inspiratory during the airway pressure is positive, negative during inspiration. So this thyroid, it compresses the trachea, and also because of the negative pressure also collapse occurs. So this results in there is a flattening of the inspiratory part of the loop, followed by this exhalation. So this is where we can see in case of variable extrathoracic obstruction. So now this loop we can see here, this is the inspiration. Inspiratory part of the loop appears to be normal, followed by this exhalation. This dotted line is the normal exhalation. But here what is happening here is this exhalation, expiratory flow is decreased. So that means this is a variable obstruction. So variable obstruction, how do you tell it is whether intra or extrathoracic? So it is only, so here why this it is only during expiratory means, this means it indicates extraluminal. So it indicates extraluminal variable intrathoracic obstruction. So what happens in case of take a mediastinal mass? So in case of mediastinal mass, whenever patient is having whenever the patient inspires, so what happens? The negative intrathoracic pressure will be there. This negative intrathoracic pressure, it maintains the patency of the trachea, maintains the patency of the bronchi, okay, or the intrathoracic trachea and the bronchi. So during expiration, what happens? During expiration, the positive pressure of the pleura and also the pressure by the extraluminal obstruction, that is extraluminal mass, that is mediastinal mass, it compresses upon the bronchi or the trachea and it causes this obstruction. So this results in expiratory airflow limitation. So this is called as variable intrathoracic obstruction in case of mediastinal mass. So here this dotted line is the normal. Okay, so here what we are seeing is this there is it almost appears to be a normal, but the volume of the, that is the flow rate also appears normal, but the volume it is decreased. Okay, this indicates a restrictive pattern type of lung disease. So here your FEV1 will be decreased, your FVC will be decreased. So it is not shown in this one. So this FEV1 and FVC are not shown. Basically the tidal volume is increased and is decreased. So the tidal volume is decreased, but the flow rate is normal. It is normal. So in case of restrictive lung disease, what happens here is, so there is your FEV1 is decreased and FVC is also decreased, but FEV1 to FVC is normal or increased. So there is increased elastic recoil due to the increased flow rate. Okay. So now coming to what are the advantages of this loop technology. So these advantages of the loop technology are, it provides a real-time information. So we can know with each breath what is happening. So whether there is an increase in the airway resistance, or there is secretions in the ET tube, or there is an intraluminal obstruction, or there is a change in the compliance. Okay, all these can be diagnosed with the help of this one. And also compared to the scalar, the changes are very more obvious, and also the information it provides, it justifies the extra cost. So what are all the changes we can diagnose with the help of loops? Or in case of pressure volume loops, we can know there is changes in the compliance of the lungs, and also the area within the loop, that is called as the work of the breathing. If the area of the loop increases, indicates the work of the breathing is also more, and also patient ventilator synchrony we can diagnose. And also we can know if there is any increased airway resistance also. In case of pressure volume loop, we can diagnose. In case of flow volume loop, mostly it helps in diagnosis of airway obstruction, that is the type of the airway obstruction, and also air trapping and auto peep. It is very much obvious in case of this flow volume loops. And also both in case of pressure volume and flow volume loops, we can diagnose both this, any leak is there or not, and any secretions are there or not. Okay.